Hello, students and parents. Thank you for taking the time to view this presentation. The West Springfield High School Student Services Department has put together some resources and information regarding mental health and wellness support. Before we get into the presentation, we would like to take the time to introduce the Student Services team, starting with our counselors in alpha order.
Hello, my name is Kimberly Green Herbert, and I work with students with the last names A through BL.
Hello, I'm Ms. Saldaña, and I work with students with the last names BR to DAB.
Hi, my name is Miss Covert, and I work with the caseload DAY through GRE.
Hi everyone, I am Miss Beaver and I have students with the last names GRI through J.
Hello, I am Rosalind Abrigo and I work with students K through MAX.
And I am Betty Bronex and I work with students MAY to O.
Hello, I'm Deontay Young and I work with students with last names P through SAN.
Hi, I'm Miss Kim and I have students with the last names TOR through Z.
Hi, everybody. My name is Tisa Frederick, and I serve as your College and Career Center Specialist.
My name is Mr. Kabadik, and I'm a school counselor intern.
Hi, I'm Anne-Marie Colligan, and I'm the school social worker.
Hi, I'm Cynthia Crisafulli. I am the emotional disabilities clinician.
Hi, I'm Wendy Seeger. I'm the school psychologist.
As mentioned earlier, we are presenting about mental health and wellness support, especially during this time in a virtual setting where a visit to the school or phone call is no longer as accessible. It is not easy to navigate the resources available to our students and families. We want to take this time to let you know about our roles in supporting your student and the mental health services offered in the community. Again, here are their school counselors with their email addresses available.
School counselors focus their efforts on designing and implementing school counseling programs that promote academic, career, and social-emotional success for all students. To do this, the school counselor's role include deliver instructions that proactively enhances awareness of mental health, promotes positive, healthy behaviors, and seeks to remove the stigma associated with mental health issues, provide students with appraisal and advisement addressing their academic, career, and social-emotional needs, recognizes mental health warning signs, including changes in school performance and attendance, mood changes, complaints of illness before school, communication with teachers about problems at school, and dealing with existing mental health concerns. School counselors also provide referrals to school and community resources that treat mental health issues and educate teachers, administrators, families, and community stakeholders about the mental health concerns of students.
Hi again, I'm Mrs. Colligan. I'm the school social worker, and my role at the school is to provide clinical support to students and assist families in accessing mental health, medical, and basic need resources. I also participate in the special education evaluation process, and I do social history evaluations. And my contact information, phone and email are provided on the slide.
Hi, I'm Cynthia Crisafulli. I'm the emotional disabilities clinician. I'm a school social worker. I provide clinical services, consultation, and resources to students who receive emotional disability support through their IEP program.
Hi, I'm Wendy Seeger, the full-time school psychologist. I complete psychological evaluations as a part of the special education eligibility process, and also provide clinical support and help students access academic and mental health resources.
So what is a crisis and what versus a concern? If you are concerned, that someone's safety is at risk, that is a crisis, and it requires immediate intervention and action on your part, such as telling a trusted adult. A concern may require adult intervention, but not immediately, and there is no risk to anyone's safety or well-being. So a crisis examples include safety risks to self or others, extremely distressed or agitated, very depressed mood, hopelessness, extreme fear or anxiety, paranoid thinking, art and writing focused on themes of death, refusal to attend school. Concerns are maybe withdrawn, anxious, or exhibiting a change in normal routine, may appear sad, may be misusing substances, mood may be flat, may have a change in work habits, experiencing increase in tardiness or absences, grades dropping. And you can see a website there that explains a crisis versus a concern.
So regardless of whether it's a mental health crisis or concern, your first step is to contact your school counselor. If it's a mental health crisis, it may be that your child needs to be hospitalized in an inpatient setting, or there are also intensive outpatient options, and we're going to go over all of those in a moment. If it turns out that it's a mental health concern, we can help you to provide community-based resources for counseling, which is considered outpatient services. For either one, for a crisis or a concern, after you've contacted your school counselor, a member of the clinical team may become involved with helping you with that as well.
So when we think about mental health resources within the community, there are several recommendations that we would give. Number one is discuss your mental health concerns with your child's doctor to determine if their health condition that might need to be ruled out. For example, is your child sleeping a lot because they have a vitamin deficiency, or maybe their iron levels are low? So ruling out whether there's a medical condition that may be impacting them is really important. Some doctor's offices offer mental health services, so finding out about that. You may not realize that a psychologist or social worker might be on staff at your doctor's office. And then also seeing if your doctor might provide a list of potential providers in the community: counselors, psychologists, social workers. Another option is to look at your health insurance website to see if the search engine provides you an opportunity to search, is there a female therapist focused on adolescents within 5 miles of your home accepting new patients? If there's a particular concern that you have, whether it's an eating disorder, depression, anxiety, you can put that information into the search engine, and the search engine will populate a list of potential providers. Merrifield Center is the main office for mental health services through the Community Services Board, CSB. And so if you live in Fairfax County, you can call 703-559-3000. During this time, CSB has transitioned mainly to telehealth services via Zoom for healthcare. So those services would be provided by phone or video. Support includes information on community resources, as well as screening and assessment for individual or family outpatient counseling. You can also call 703-383-8500 for more information. Or you can go to the following websites and explore the services that they offer. Another option would be to use a search engine such as Psychology Today, because they also have the ability to search for providers in your area that may accept your health insurance.
After starting with an individual therapist, you and the therapist may feel a higher level of support may be required for your child. Intensive outpatient programs are the next level of support. IOPs are designed specifically for adolescents, typically between the ages of 13 and 18, who are experiencing emotional or behavioral problems that are significantly impacting their ability to be successful within the home, school, or community. The IOP adolescent is able to attend school and maintain a level of safety that does not require constant supervision. The student is also willing to participate in not only individual therapy, but group therapy. IOPs are often held after school hours, usually 3 to 4 days a week, and typically last with about 8 to 10 weeks. Several local IOPs are offered through Inova Kella Center, Dominion Hospital, and Discovery Mood and Anxiety Program. Information can be accessed by calling or looking at their websites.
So the next level up of service for students who are experiencing a crisis from an IOP program would be a PHP program, and that's a partial hospitalization program. It's a short-term intensive program for adolescents ages 13 and above who are experiencing an acute crisis. They provide multidisciplinary assessment, treatment, stabilization, with the goal of maintaining safety, crisis management, and symptom relief. Those programs typically are held Monday through Friday during school hours, and your school team will help to collaborate with you to develop an academic plan. The following 4 programs are provided in the Fairfax County area at Keller Center, Dominion Hospital, Fort Belvoir for military families, and the Discovery Mood and Anxiety programs. And we've provided the phone numbers and websites for each of those programs as well.
So if your child has been participating in weekly therapy or has maybe attempted to participate in an intensive outpatient program or one of the partial hospitalization programs, and you and your provider have determined that that isn't enough of a level of support, or if you've reached some type of crisis situation and you just feel like that weekly counseling isn't enough, then there are some additional options within the community. The first one is called Children's Regional Crisis Response, CR2. That is for 24-hour rapid response and short-term ongoing follow-up for youth in a mental health or substance abuse crisis. And it's especially for the prevention of unnecessary hospitalizations and placements outside of the home. The service is grant funded, and therefore it's free to families. Because they are crisis oriented, they do not maintain a waiting list. Both children and parents have to agree to participate in the therapy, and that therapy is usually provided in the home for about 45 to 60 days. The goal is to stabilize the child and the family while connecting them to more long-term interventions and supports. Another option that families have is something called Leland House. United Methodist Family Services operates Leland House, which provides short-term, up to 45 days, intervention and stabilization for children ages 12 to 17 in Fairfax County who are in crisis and cannot remain in their home or current residential setting. Qualification for admission is assessed through Merrifield Center, which is the outpatient center run through the Fairfax County Community Services Board. And while at Leland House, students continue to attend school on site as well as participate in individual, family, and group therapy. When the youth is discharged home, families have the opportunity to receive ongoing support and services through a youth and family team meeting process. So again, this is a short-term residential stay where students can stay for up to 45 days to help them stabilize so that they can safely return back to the home environment. Another short-term residential option is Second Story. Second Story is a short-term crisis stabilization and emergency housing for youth ages 13 to 17. It's a very structured program that includes individual, group, and family counseling. The youth must be willing to be part of the program, and the parents need to approve that as well and be active participants in the family therapy. The youth typically stay for up to 2 weeks and are provided with access to transportation to their base school. So if your child did go stay at Second Story, which again is a free service, transportation would be provided so that they could continue to come to school on a daily basis. And Second Story is located in the Tyson's Corner area of Virginia.
If you or anyone you know is in crisis and/or are harmed to themselves or others, please call one of the numbers listed on the screen. Fairfax County area hospitals provide emergency services, including Fort Belvoir Community Hospital, which is specifically for our military families. For any immediate crisis needs, please call 911.
The PRS Crisis Link is another great resource for students. Crisis Link is the provider of the lifeline for Fairfax County. And if you call either of the numbers on the slide, you'll be connected with a crisis worker who is trained to help you with a challenge that you're facing. You can also text "need help" to 85511 for the texting option. You might be thinking to yourself, if I say that I'm thinking about suicide, will the center call the police? In most cases, no. They understand that not every person who is thinking of suicide needs that kind of intervention. What they will do is they'll provide a structured process to help you determine how safe you are and what steps and support you might need to keep safe from suicide. This might include a safety framework, connection to an outpatient mental health provider like we mentioned before, or working with your family and friends to help you feel more connected and supported. Every person is different, and they know that not all approaches work for everyone. They are considered mental health responders though, and so if someone is unable to keep safe from suicide, they will work collaboratively with you to support your need for safety. Another question you might have is, can I talk with a crisis worker if I'm not thinking of suicide? And the answer is absolutely. They are a resource for any kind of crisis. So symptoms of anxiety, depression, and substance use are complicated, and trying to cope alone can deplete you of all your emotional resources. They are here to be a community support for you when things get difficult. And if you are worried about a family member or friend, you can also call about that too. All of their services are free and confidential, open to all ages and backgrounds, and they're available 24/7, 365 days a year. These two videos were created by FCPS, and they feature fellow FCPS students. The video on the left shares tips for staying connected with friends in the virtual setting, and the video on the right shares tips on maintaining general wellness, so feel free to check that out.
So finally, we just wanted to leave you with some strategies for students to manage feelings of stress during these times. The first is very simple. It's deep breathing. The process to do it formally is to breathe in through your nose for a count of 4, hold it for a second, and breathe out through your mouth for a count of 8. And you're going to repeat that at least 3 times. Research shows that slowing down and deepening your breath will calm the sympathetic nervous system. 5-4-3-2 grounding is especially effective if a student is feeling anxiety, and they just want to notice 5 things that they can see right now, 4 things you can touch, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. And that just brings you right back into the present and calms down from whatever is causing the anxiety. Additionally, mindfulness applications are available throughout. There's Headspace, Calm, 10% Happier, Insight Timer. They all provide guided meditations. And mindfulness can help on a variety of levels in terms of concentration, anxiety, emotional regulation. So we really recommend that students try mindfulness and meditation. Happiness Homeroom is a 60-minute lecture provided by a Yale University professor, and she offers 7 evidence-based tips on how high school students can increase their well-being during virtual learning. Another recommendation we suggest is for to join a West Springfield High School club or activity or team. It increases social interaction. It might get you into something that you're interested in, and it might also provide exercise. And there's a lot of research to show that 30 minutes of cardiovascular exercise every day can actually reduce anxiety and depression symptoms, similar to a medication. Another idea is to take a class or pursue a hobby or learn a new skill. A lot of students are doing this these days on YouTube. But another option is that Fairfax County Recreation is also offering classes at this time. Another thought is that FCPS has created the Healthy Minds podcast, and they provide mental health resources and tips for FCPS families. And then finally, the Office of Psychology Services has a Twitter account that offers tips on mental wellness.
Thank you for taking the time to view this presentation. Please reach out to West Springfield Student Services Department if you have any questions or concerns about mental health or wellness.